What if I told you some of the pills sitting quietly in your medicine box, the ones you trust every day, could actually be increasing your risk of a heart attack or stroke after 60? Sounds shocking, I know. But as a doctor, I've seen this happen more often than you'd think. Patients doing everything right, taking their medicines regularly, and still ending up in emergency rooms. Not because they were careless, but because no one warned them. Today, I'm going to share 5 very common pills that can silently increase your heart and brain risk after 60. And more importantly, what you should do instead? This is not about scaring you, it's about protecting you. As we age, our body changes. Our heart becomes more sensitive, blood vessels become less flexible, and the way we process medicines slows down. A pill that was completely safe at 40 may not behave the same way at 60 or 70. And here's the problem, many people keep taking the same medicines for years without reviewing them. I recently had a patient, 67 years old, very disciplined, never missed his medications, but he came in with chest pain. When we reviewed his medicines, one of them was quietly increasing his risk. That's why this video matters. Let's go through these one by one, very simply, so you can understand, not panic, and make better decisions. These include common tablets people take for joint pain, back pain, or headaches. What is it? These are anti-inflammatory painkillers, often used daily by older adults for arthritis. Why is it a problem? These medicines can increase blood pressure, cause fluid retention, and most importantly, make your blood more likely to clot. All of this puts extra strain on the heart and blood vessels. Real life example. An older adult with knee pain starts taking these pills regularly, maybe even without a prescription. Over time, their BP rises, and one day, they experience chest tightness. Hidden risk. Many people think it's just a painkiller. How harmful can it be? But long-term use, especially in high doses, can significantly increase heart attack and stroke risk. Better alternative, use the lowest dose for the shortest time. Consider physiotherapy, gentle exercise, or topical gels instead of daily tablets. And always check with your doctor if you're taking them regularly. These are commonly used for acidity or heartburn. What is it? Medications that reduce stomach acid, often taken daily for months or years. Why is it a problem? Long-term use may affect magnesium levels, kidney function, and even blood vessel health, indirectly increasing cardiovascular risk. Real-life example, someone starts taking it for occasional acidity, but never stops. Years go by, and it becomes a daily habit. Hidden risk, people think, this protects my stomach, so it must be safe forever. But long-term unnecessary use can create problems elsewhere in the body. Better alternative, use it only when needed, not forever. Focus on lifestyle, smaller meals, avoiding late-night eating, reducing spicy and oily foods. Very common especially after retirement. What is it? Pills taken to help fall asleep or stay asleep. Why is it a problem? These medicines can slow brain activity too much, leading to falls, confusion, and reduced breathing at night. Poor oxygen levels and stress on the body can indirectly affect the heart and increase stroke risk. Real life example, a person starts with half a tablet, then needs a full one, then can't sleep without it. Hidden risk. They feel, at least I'm sleeping better. But the quality of sleep is often not natural, and dependence builds silently. Better alternative, improve sleep habits, fixed sleep times, less screen use at night, relaxation techniques. If needed, use medication only short-term under guidance. Now this is important because diabetes itself already increases heart risk. What is it? Certain older diabetes medications or incorrect dosing. Why is it a problem? Some medicines can cause low blood sugar, which stresses the heart. Others may lead to weight gain or fluid retention. Real life example. An older patient continues the same diabetes dose despite eating less or losing weight, leading to frequent low sugar episodes. Hidden risk. Sugar is controlled, so everything is fine. But how it is controlled matters. Better alternative, regular medication review is key. Newer options are often safer for the heart. Never adjust doses yourself. Always consult your doctor. These are sometimes used for joint pain, allergies, or other chronic conditions. What is it? Steroids or hormone-based medications taken for long periods. Why is it a problem? They can increase blood pressure, blood sugar, and cholesterol, all major risk factors for heart attack and stroke. Real life example, someone takes steroids for chronic pain relief, feels better initially, but slowly develops weight gain, high BP, and fatigue. Hidden risk, They work like magic, so they must be safe, but long-term use without monitoring can be dangerous. Better alternative. Use only when absolutely necessary and always under supervision. Regular checkups for BP, sugar, and cholesterol are essential. So let's bring this together. These medicines are not bad. They are useful, sometimes even life-saving. But after 60, your body changes, and so should your approach. Painkillers, sleep pills, acid reflux meds, diabetes drugs, steroids, the real danger is not the medicine itself. It's using them blindly, for too long, without review. Your body is constantly changing. Your treatment should too. If you're over 60 or have a loved one who is, take this as a gentle reminder, sit down with your doctor, review every single medication you're taking, even the ones that seem harmless, because sometimes small changes can prevent big problems. If this video helped you understand something new, share it with someone who might need it. And remember, good health isn't just about taking medicines. It's about taking the right medicines at the right time for the right reason. Take care, and I'll see you in the next video.